Most of the time, the obvious thing is the bicycle accident, the beer at a party, or slipping in the pool. But these are actually rarer accidents. The most likely scenario for a chipped tooth is actually if you grind your teeth over time, which causes some small fractures inside the tooth, and then it's always the same. You eat a soft roll in the morning or toast with some lovely beans, and then part of your tooth comes off. So actually chipped or cracked tooth is something which develops over time. It's like if you drive your car 40,000 miles, you need to change the tires. So if you use your teeth for chewing every day, that would actually be okay. But if you grind additionally, that sometimes weakens the tooth structure, leads to small cracks which then expand, and eventually you have a cracked tooth. That is very interesting. So if you have a chip in your tooth and you lost tooth material, I'm afraid it will not grow back, ever. If you just have a small crack, the tooth has a certain tendency, the dentin, not the enamel, the dentin has a certain tendency to heal itself. But of course, if the crack is too big, it might have serious side effects. So no, under normal circumstances, the crack will not reseal. And if you've lost a little bit of tooth, that will unfortunately not grow back. Well, if it's a minor chip and the chip is contained within the enamel, which is the hard tooth structure of a tooth, you might actually get away with not doing anything. However, when the underlying dentin, which is the softer part, the major part the tooth consists of, is exposed, then you may develop decay, or the crack may go further and you might even crack and leave and lose a bigger chunk of your tooth. So in any case, check with your dentist, and if it's a minor crack, minor chip, not a problem, unless it's in the aesthetic area. If it's a bigger one, better check it out and sort it out. Yeah, like I said, if it's a really small chip, you may get away with not doing anything. If it's a small to medium-sized chip, normally standard option is in the posterior region, a filling, or even the anterior region, the front teeth is a filling. So a composite filling, a white plastic bonding, if so to speak. And if the damage goes a bit further, in the posterior region, you can place either an inlay, which is very similar to filling, just ceramic instead of composite, or if the crack gets bigger and bigger, or the lost tooth material gets bigger and bigger, you can place a partial crown or an onlay. And if the crack is really massive, you might actually have to have a full crown. And if the crack is huge, so that the entire tooth is lost, then you might have to replace the missing tooth with an implant or a bridge. No? Or in the front region, if you have a chip in your front teeth and that can't be dealt with a filling, then you may consider a veneer. Well, let's start with a healthy tooth. A healthy tooth doesn't need anything. If a healthy tooth develops a small decay, you normally do a small filling, this composite bonding, to repair that. If the filling gets bigger or is too big and the filling material itself is not sufficient anymore to restore the tooth properly, you can place an inlay, an onlay, or a partial crown. And if even that is not possible anymore and you need a full tooth coverage to restore the tooth properly, then you place a complete crown. And the complete crown, so to speak, replaces the entire enamel the tooth previously had and restores the tooth properly again. So this healthy tooth, small filling, bigger filling, inlay, onlay, partial crown, and then crown going from least damage to most damage to your tooth.